Hi, myself Dr. Sudhakar Reddy Tirupati, pediatrician with more than 30 years of experience in modern medicine and 14 years of experience in homeopathy, which I call spiritual medicine, and some experience in acupuncture and Kundalini yoga. Today I am going to talk the need to reduce the fever, and I am not going to talk of the regular things which you can find anywhere, but I am going to talk of one of the rare subject, that is how acupressure helps to reduce the fever. Not only reduce the fever, simultaneously how it improves the immunity in your child. First thing, why to reduce the fever? Because fever usually indicates body defense against infection. Body reacts to the infection of viruses and bacteria and produces heat so that they are destroyed easily. But it is like a double-edged sword. Sometimes the fever overshoots, and particularly in children from 6 months to 5 years, some children are prone to what we call seizures or fits or convulsions. Not only that, if the fever is more in hyperpyrexia, there is more chance for brain damage and death. So sometimes the need to reduce the fever arises out of parental anxiety. Of course, parents expect their children to eat, play and look normally even in fevers. So usually they expect immediate relief. Particularly in a country like India, even the doctor is pressurized to write more medicine, so there is a chance for over prescription. But there is urgent need to control fever, particularly in any child more than 3 months and has a temperature of more than 40 degrees or 104 degrees Fahrenheit, or above 40 to 41 Celsius, equivalent to 104 to 106.5, we call hyperpyrexia. There is immediate need to reduce the fever. And if the fever is above 102 degrees Fahrenheit for more than 2 days or keeps coming back, in a younger child less than 3 months infant, the temperature is above 100.4 or higher, there is a need to reduce the fever. As I said, control of fever may be demanding social need to reduce parental anxiety and antibiotic abuse, apart from treating the root cause. After being a pediatrician for 30 years, I know that 90% of infection in a child is viral infection and not more than 10% are bacterial infections. So in any virus infection, antibiotic has no role. That may be required in bacterial infections. So the proportion of antibiotic usage should be 0 to 10%. But in reality, the percentage is somewhere around 90 to 100%, particularly in a country like India. At least in Western countries I have seen, most of the child doesn't receive antibiotics unless fever is more than 5 days old, unless it is very high fever. And this unnecessary use of antibiotics disturbs the gut bacterial flora and child immunity becomes weak. So what is the way available in acupuncture, which is more than 5,000 year old? On the left side you can see that is depicting the foot reflexology. This is the image on the tomb of a king's physician, just saying that foot reflexology was practiced even 4,500 years back. So this is the medicine which has stood the test of time. If you are still skeptical, you try this, you do this exercise, press on your medial border of the foot, and if particularly you have any back pain, you can see nicely exactly matching points, you will see that areas will become sore or tender to touch. You can also see the example of a reflexology of breast, how we can apply. So this is just show you how foot reflexology works. Actually our spine is represented here on the medial aspect of the feet. This corresponds to cervical spine. If somebody is having cervical spondylosis, this part will be painful. So come back slowly down. This is along the edge of the bone. Then this area is lumbar. If there is some lumbago or back problem, lower back, this area becomes tender or sore to touch. See, in different people you will clearly understand this. Come lower down, then comes the sacral area. So this is how our spine is represented on the medial side of the feet, and this lumbar almost corresponds with the arch of the feet. And other thing I want you to check is, if you have some women in your house lactating, feeding the baby, then this is the area of breast. So see, if she is actively lactating, this area will touch the feet of the woman. This area will be sensitive and sore to touch. And if you do everyday slight pressure on this area, milk output will definitely increase. So for those who are skeptical about the foot reflexology, they can check these points. Spine here and breast, of course, in a female. In a woman, this is more prominent. And to understand this, to understand acupuncture or acupressure, there is one basic measurement you have to know, what is known as kun. That is the measurement which applies to the patient, not your measurements. So 1 kun is the distance between creases of your middle finger or the breadth of your thumb. So today I am going to show you one basic measurement in acupuncture, that is kun. This is my middle finger. Measure the distance between the two creases of the joints. It is from 2 to 4 centimeters, that is 2 centimeters. Other place where we can measure the distance is width of the thumb. At the joint you can measure, again here also it is showing 2 to 4 centimeters, between 2 to 4 centimeters, that means 2 centimeters. So one of the most important point useful to reduce fever in children, or in any case even in adults also, and to improve simultaneously improve the immunity, is what is known as DU14. Its location is there exactly in the midline at the base of the neck, between the dorsal vertebra, 7th cervical and first thoracic vertebra. So today we are going to learn one important point, that is DU14. When he bends the neck, you can see almost 3 vertebrae which are prominent. The one which is prominent on the top is C6, but when he extends the neck, it almost goes inside. You can see it has gone inside, but C7 is still there. Right. Then how to differentiate this C7 from T1? When it turns head to the sideways, this C7 moves, this vertebra moves. I can feel the movement below my finger, but T1 doesn't move so much. C7 moves easily. So this DU14 is between this C7 and T1. That is the point, how to locate it. This point DU14, it works in all the stages of fever, first stage, second stage and third stage, and it is unique in its ability to clear pathogens from all these 3 stages. The other name for DU14 is point of 100 taxations, means it illustrates the ability of this point to treat deficiency and exhaustion of the whole body, that means weakness manifesting as lack of strength. And this is the most potent immunity enhancing point. So if you learn this technique of using acupressure on this point, can not only reduce the fever in emergency cases, can also simultaneously enhance the immunity. The second point which is useful to reduce the fever is LI11, large intestine 11. The location is at the outer end of the elbow crease, when the elbow is semi-flexed. If you flex your elbow, you can see a crease here, and at the outer end of the crease is the location of this LI11. This is very useful for fever that doesn't recede, and it is one of the important immunity booster point. The third point is SJ1, Shanjiao 1. The location is on the dorsal aspect of the ring finger, 0.1 kun from the ulnar corner of the nail. So this is the ring finger, ulnar corner means towards the little finger, 0.1 kun above that. This is the third point, useful to reduce the fever. You have to learn the technique of pressing that point. Fourth point is bladder 40, BL 40. Its location is at the back of your knee, at the midpoint of the popliteal transverse crease. Just bend your knee, you can see a crease, transverse crease at the back of your knee in the popliteal fossa. So that point is there in the middle area between the two tendons. Its actions are, it cools the blood, any fever with absence of sweating, and fever with alternating with chills. So these 4 points are very useful to reduce the fever, and first two, as I said, they also enhance the immunity. They can be applicable even in adults also. Because something heat stroke or sunstroke is related to fever, I want to cover just one more point to tackle the heat stroke. There are 2 points which are very useful in heat stroke. First one is BL party, which I already discussed. The second one is P3. This is the water point of the pericardium channel, and it is located in the antecubital fossa. When you bend your elbow, you can see this is the muscle, biceps muscle, and you can see the tendon, very strong tendon here. Anybody have it? Just on the medial end, inside of that tendon is that point in the fossa. This is the water point of the pericardium channel. This is particularly useful in reducing the summer heat or heat stroke with or without fever, sweating, vomiting and diarrhea. And BL40 is particularly useful again in the summer heat and stops vomiting and diarrhea, and febrile disease characterized by absence of sweating. And both these points can be pressed, and for more immediate results in urgent cases, these points can be bled also. You can just poke the needle at that point, and if the little blood comes out, usually it gives a dramatic improvement. I have to make a small disclaimer here. The same methods can be applied to adults also. This presentation is only to create awareness and educational purpose only. Thank you for watching this video. Please subscribe and share if you think this is useful and truthful video, different from the routine. And thank you for sparing time. Thank you for watching. See you again. Thank you.